Compassion Now, Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, USA presents this week's breaking news in wellness and in health for all people and all professionals. Hello, I'm Pete of Dr. Z and Pete. Presently, I'm the president of Bethel House of Refuge in Muhammad, Illinois. Previous to that, I was the owner-operator of a commercial construction business operating in the central Illinois area. I and my wife, Stephanie, reside in Farmer City. Stephanie works at the University of Illinois Electrical and Computer Engineering Department as a travel specialist. My co-host, this is my distinguished co-host, Dr. Alex Rama-Zachariah. Doc is also a medical professor, and as I mentioned, he's a CEO of CNN4All International. Recently, Doc was the chief medical officer, the medical director, right, Doc, at
Yes.
Provena, now Presence United Medical Center in Danville, Illinois, in all of 2008 and part of 2009. And prior to that, he was dean of one of the top 12 medical schools in all of India, Christian Medical College in Ludhiana. That's 12 out of 300 medical schools. So we have a very experienced expert with us today. Doc and his wife Prema is also a retired physician and professor. They spent 43 years at Christian Medical College in Ludhiana, first as students, then as faculty, and retired in 2000, where they are now residing in Urbana, where they've been since 2005. Doc, you got a great resume, a lot of experience. We're really privileged to have you with us as co-host. I would like for you to explain to the folks what we're about here.
Please note that this is not medical advice. This is for your information only. Do not change your treatment based on this info. You may mention this to your physician, and you may even ask him to watch.
Oh, yeah. Yeah, please do. Ask him to watch, and if you need to communicate with us, you can do it on email, breaking news at CNN4All.com. That's breaking news at CNN4All.com. Well, we've got a lot of stuff on the table today, Doc. It's good to have you with us, even in the cold weather. I can see you're doing well. Let's get right into it. Many men start testosterone therapy without clear medical need. Although testosterone use has sharply increased among older men in the past decade, many patients appear to have normal testosterone levels and do not meet the clinical guideline for treatment.
This is according to a new research accepted for publication in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism, January 2014. Since 2000, the number of men starting on testosterone therapy has almost quadrupled in the United States. The study found that more and more being tested actually had normal testosterone level, and this is cause for concern as research examines potential risk associated with testosterone use.
All right, now I'm going to press you
Yes.
on your medical expertise. This is what I think. With all of the information that's available in the information age, the emphasis on sexuality and all of these things, some of these guys have performance anxiety and all this thing, so they think it's a testosterone problem, and boom. I mean, the whole media arena is plastered. I mean, you have Viagra and Celebrex and all these things. They're on every sports program. And these guys are thinking, oh, I got a testosterone problem. When couldn't it really be stress and pressure?
Absolutely.
Diet, lack of exercise, and, God forbid, aging.
Yes.
So,
You know what? In the last 2 weeks, I must have got 4 or 5 phone calls for testosterone therapy. I tell them, please, I'm a retired medical oncologist. I won't give anybody testosterone unless the blood test shows they have low testosterone.
yeah, because it's like anything. Too much of a good thing is not going to be good, right?
And playing with fire, like testosterone, your prostate and all the other things.
Yeah, don't, please, please, please do not
Yes, that
Don't treat yourself in
treat
this
yourself.
arena, right?
Yes, and don't go by the push, the advertisement or people calling you.
Right. Oh my goodness.
Yes, yes.
Man, Doc, well, that's good.
Yes.
And we really need to pay attention to that, especially with,
That's
know,
right.
the way things are happening
Yes,
in
yes, that's right.
in the media arena. Researchers have found that exercise plays a role in how individuals feel they can manage their work-life balance. Individuals who exercise regularly were more confident they could handle the interaction of their work and home life and were less likely to be stressed at work.
Yes, these findings were reported in the Journal of Human Resource Management, January 2014.
Oh, good.
And so, it's good to exercise. Even it improves your work life.
That's right.
Less stress, less anxiety. Okay.
The researchers were from St. Leo University, St. Leo in Florida, that employers can help employees with work-life balance by encouraging exercise. That's I heard it on the radio coming in. The fitness center around here is encouraging older people to get in and exercise.
Right.
All right, we're going to go from testosterone and hormones, the maternal stress hormones, maternal smoking.
Yes.
Increases a daughter's risk of nicotine dependence, a recent study shows. Tobacco smoking by pregnant women has long been viewed as a public health risk, and because of smoking's adverse effect on development of a fetus.
Right. A new 40-year-old longitudinal
My
study
goodness.
published in Biological Psychiatry, January 2014, provide strong evidence that daughters whose mothers smoked while pregnant with them have an increased risk of nicotine dependence and addiction in adulthood, but only daughters.
Right. Oh, my goodness. Another blight
Yes.
on smoking, especially pregnant women.
Yes.
My goodness. Really? Okay. Listen to this, Doc. The amount of types of fat we eat affect health. The risk of disease in healthy adults should consume between 20% and 35% of their calories from dietary fat. Increase their consumption of omega-3 fatty acids and limit their intake of saturated and trans fats.
That's it, saturated and trans fat. This is according to an updated position paper from Academy of Nutrition and Dietetics, January 2014. A simple and effective way to improve health is to eat more fish, nuts, seeds, and to consume fewer
desserts. That's
and
cheesecake.
and convenience food.
Man, different foods provide different types of fat. Some fats improve your health. The omega-3s help your heart and brain, while some are detrimental to your health. The trans fat increases heart risk factors. Stay away from that stuff.
Absolutely.
Oh my, margarine, I see margarine on the table. I go, that's trans fat.
Go
isn't
for
it?
butter.
Potato chips.
A little butter.
Oh yeah, little butter, little.
Yes.
Okay.
Yeah.
We have a little story here about a patient that lost over 120 pounds without bariatric surgery or medication. That's a good news. For much of his life, Tom Hoppenstead thought the best thing to do at the scale was to avoid it. When he was diagnosed with low-grade lymphoma at age 50 and learned he weighed over 300 pounds, that changed everything.
That changed everything.
You bet.
The physician at the Loyola University Health System, Chicago, told him, drop the weight or you will die of a heart attack before cancer will get it. Now that's motivation. Tom started using MyFitnessPal application to monitor his exercise and calorie intake and discovered the importance of portion control and started increasing his daily exercise routine. Tom lost over 120 pounds and went from size 46 to size 36, all just by changing his lifestyle.
That would be called treating yourself. wouldn't it?
Yes, absolutely.
Well, good show. Congratulations, Tom.
Yes,
We're pulling for you to be successful there.
Yes.
Okay, now, how can you keep that New Year's resolution to get fit? Recording goals in a fitness diary and reflecting on the successes and failures and being held to account by others are some of the strategies, Doc, that have been found to maximize the achievement goals that we set in the beginning of the year to get fit.
Yes. These findings were presented January 8, 2014 to the annual conference of the British Psychological Society's Division of Occupational Psychology in Brighton, UK. The act of looking back at the fitness diaries led one to consider their attempts in different ways and gave them a motivational boost in self-esteem and self-confidence.
It's excellent.
Yes.
Very, very good. Okay. Yes. How about this? Fresh-faced, looking younger for longer. Newcastle University researchers in the United Kingdom have identified an antioxidant, Tiron, which offers total protection against some types of sun damage and may ultimately help our skin to stay looking younger longer. That's great news.
Yes, publishing in FASEB journal, January 2014. Antioxidants in our diet is from green tea, resveratrol, which is found in red wine, turmeric, which is used in curries,
Indian food,
and lycopene found in tomatoes. The team found in animals that Trion offers complete protection against ultraviolet radiation damage, and it is promising. It's
you bet.
Promising.
Absolutely. To see that, that's great.
Yes.
Test to predict early onset of heart attacks. A new fluid biopsy technique that could identify patients at high risk of a heart attack by identifying specific cells as markers in the bloodstream has been developed by a group of researchers at Scripps Research Institute, TSRI, in La Jolla, California. These are horse people in La Jolla, Scripps.
Wow. The technique is published in the journal Physical Biology, January 2014, and works by identifying circulating epithelial cells. In the blood sample, you know, these epithelial cells comes from the blood vessels. They believe the technique can now be tested on patients who exhibit symptoms but are yet to experience a heart attack. See, it sheds the epithelial cell. Currently, there is no predictive test for a heart attack. So this would be interesting. You know, fluid biopsies, you take the blood and test it.
Right. Well, you know, a friend of mine was in the hospital, and when he went in, they took his blood.
Yes.
And they told there was some enzyme that said he was in the midst of a heart attack. So if you could do it in advance, it would definitely be helpful.
Yes. Okay.
Okay.
Teen concussions.
Teen concussions. My grandson has had a couple. Increased risk for depression. Teens with a history of concussions are more than 3 times as likely to suffer from depression as teens who have never had a concussion.
Yes, this new finding is published in the Journal of Adolescent Health, January 2014. Concussion, considered a mild traumatic brain injury, can also have serious psychological effects, and many teens experience concussions through sports injuries or accidents, and less is known about long-term complications in adolescents.
Well, that same study, Doc, found that brain images in children with traumatic brain injury, TBI, and depression were actually quite similar to those seen in adults who developed depression as a result of a traumatic brain injury.
So this is something that everyone, teens and everyone, needs to take care of.
Especially in interscholastic sports.
Yes.
Are you listening?
Yes.
Kids' ear infection cost us the U.S. healthcare system nearly $3 billion annually. Acute otitis media, or ear infection, is the most common ailment among kids of preschool age and younger in the U.S., primarily because children have immature middle ear drainage systems, higher exposure to respiratory illnesses, and undeveloped immune systems, unless they've been breastfed.
This new study by UCLA and Harvard researchers was published in the journal, The Laryngoscope, January 2014, the take-home message that the common ear infection is an extremely costly entity with significant financial burdens of the health care
You bet.
system. Yeah.
Well, we're with Obamacare and all the things
Yes.
that are supposedly helping us, we better be careful
Yes.
of the monetary aspects.
Yeah.
We want to thank you all for watching. I think that I heard Dr. Ross was
Yes.
with us again.
Yes.
So he'll be joining us, and we'll have a panel discussion with
Yes.
Dr. Raymond, Dr. Ross, and myself, and we'll be right back.
Yeah, 10 minutes only.
Okay.
Yeah.
I found out I'm pregnant.
I really felt pressured.
I wasn't ready to be a mom.
I felt scared. I didn't know what to do.
If you're facing an unplanned pregnancy, you don't have to feel alone. We can help. Call or go online today to find a nearby women's center that can help you completely confidentially and without cost. If you think you're pregnant, discover your best options. Call now or go online today.
Compassion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, presents this week's breaking news in wellness and health for all people and all professionals. And this is our panel discussion. I'm the Pete of Dr. Z and Pete, and this is my distinguished co-host right here, this fellow, Dr. Alex Rama Zechariah. And today we have our distinguished expert, Dr. Ross Yoha, joining us. Good morning, Dr. Ross. How are you doing today?
Wonderful. Good to be here again.
Well, it's good to have you, and we're going to jump right in. This is an interesting topic. Let's talk about breastfeeding babies and the benefits of breastfeeding, okay?
You know what? That is a very important subject. Making the decision to breastfeed is a personal matter. It is also one that is likely to draw strong opinions from friends and families. I hope it will be a strong opinion for it.
Yes.
Many medical authorities, including the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists, strongly recommend breastfeeding. That you and your baby are unique. The decision is up to the mother.
Aha.
You know, the breast milk provides the ideal nutrition for infants. It has nearly a perfect mix of vitamins, protein, and fat. Everything your baby needs to grow, it is there. And it is all provided in a form more easily digested than infant formula. That's correct.
Well, you know, Dr. Ross, I've noticed in the mammalian kingdom, the animal kingdom of which mammals are a part, that man is the only mammal that insists on giving their offspring something other than mother's milk.
What a tragedy.
It is a tragedy.
You know, I like to sing a song.
Okay.
Breastfeeding must be encouraged. Nature's way is the best.
I agree.
Perfect fluid food for our babies. Our babies deserves the best. Breast milk comes from all three sterilized. Comes in the best container.
I agree.
That makes the baby very happy and very baby friendly.
Oh, yeah, it does. I got a question. I've heard that breastfeeding also helps in babies that have infections.
You know what? The breast milk contains antibodies that can help our baby to fight infection, viruses,
Man.
bacteria, you just name it.
Yeah.
And the breastfeeding lowers babies' risk for having asthma
My goodness.
or allergies.
Oh,
Plus, babies who are exclusively breastfed for the first 6 months without any formula have fewer ear infections, and they have fewer cough and cold, and no bouts of diarrhea. They also have fewer hospitalization
Yeah.
and trips to the doctor.
that's great news. Why would you do anything else, huh? I tell you what, my wife with my firstborn was one of she was the only woman that was breastfeeding
Right.
in the baby on the baby floor, and the nurses and everybody were kind of looking at her like she was odd. But I think that's flipped. There's a lot more women in the United States breastfeeding than ever before, I think.
Breast milk contains antibodies. You know, mother's antibodies.
Oh.
Breast milk contains antibodies, white viruses and germs, dead germs. Less ear infection, cough and cold. No diarrhea at all. Let me sing that again. Breast milk contains antibodies, white viruses and germs. Less ear infection, cough and cold. Cough. No diarrhea at all.
That's excellent news. Now I got a question. You talking about all of those benefits. Does it have brain benefits?
Well, that's extremely interesting. Breastfeeding has been linked to higher IQs in later childhood in some studies.
Huh.
Okay, what's more, the physical closeness,
Yes.
skin-to-skin touching, and eye contact all help your baby bond with you, and you feel secure.
Oh my goodness, that's great news, isn't it?
Yes, breastfeeding makes our baby smart, linked with higher IQ to all. Skin-to-skin contact, eye contact leads to greater bonding. Breastfeeding makes our baby smart. I'm so glad that your 23 grandchildren, they are either all breastfed, and they will have higher IQ.
All of them are.
Breastfeeding makes our baby smart, linked with higher IQ. Skin-to-skin contact, eye contact leads to greater bonding.
All of those things affect, right? I mean, that eye-to-eye, skin contact, all of that stuff, and the warmth of the mother being up close, you bet. What about the benefits for the mom?
Oh yeah, that's very interesting. Breastfeeding burns extra calories, so it can help mother to lose pregnancy weight faster.
Oh man, that's a good
Breastfeeding
idea.
also lowers your risk of breast and ovarian cancer. It may lower your risk of osteoporosis and falls and breaking.
Yeah, that would be great.
Breastfeeding burns calories. Breastfeeding burns calories. Mothers lose extra weight. Breastfeeding protects mothers from ovarian cancer. Can you summarize all this, what he said?
Well, yes. I mean, the breastfeeding benefits the babies. They have less infections, less sickness, less physical problems. They also seem to have higher IQs, and they're more comfortable, established, less psychological difficulties, I would say. They're more well-adjusted. Don't you think so, Dr. Ross?
Absolutely.
And it's the physical closeness, skin-to-skin touching, eye contact, and bonding. That's great, and it helps the mom. They burn up calories, they get around better, and it reduces the rates of ovarian cancer and breast cancer in women that breastfeed, as well as dropping the risk of osteoporosis.
And it is free.
And it is free. Comes with the package. Well, that's great news, Doc. Man, what a great panel today. We appreciate your insight and all of your experience in this area, and we hope you'll be back with us again real soon.
I really enjoyed it.
All right, good. Thanks for coming. We appreciate you big time. We'd also like to thank Science Daily, and that's where we get our information from, as well as the City of Urbana's UPTV production team, our coordinator, Jason Liggett, our intern, Caleb Serpentis, and Jacob Bernard, our 3-camera intern, and the UPTV station manager, Jake Schumacher. We want to thank the Chorister Fellowship in Tiruvala, Kerala, India, for their music score and their hallelujah ending. I would like to thank you, Doc, for being with us as our resident expert, and we would like to thank you all for watching, and we'll see you next time.